Hello everybody, my name is Dr. Zak, and what I'd like to do today is speak to you about the 5 questions you should ask prior to doing dental implants. So without further ado, let's get right to it. The first questions you should ask of your doctor is, number 1, am I the right candidate for this, to do an implant? Do I have good enough bone, first of all? Is my health condition good enough to have a proper integration? And are my habits acceptable for implants? Some people come in and they're heavy smokers. Those people will have a much more difficult time having implants integrate than somebody who's got a perfect health condition and no bad habits, take care of their teeth perfectly well, brush and floss twice a day. But some people are more challenged. They have a lot of plaque and tartar buildup and have to be very, very careful about their home care in order to make sure that the implant doesn't get infected or rejected after placement. The second question you should ask is are you an expert at placing implants? So a lot of dentists will go out there and take a 3-day or 3-weekend course on implants and literally see it happening 3-4 times in the lab, and then they feel like they're ready to place. So they'll do something Friday, Saturday, Sunday, come in Monday and bring in their first patient and start doing implants. I would highly recommend you're very, very careful with having somebody doing that. Somebody has to be very experienced at this procedure. It's a very difficult procedure and has to be closely monitored, and somebody has to be an expert at being able to place the implants. So you should, when you speak to your doctor, you should ask them, how many implants have you done? What was the background and training you've had? How many implants do you do per month? Per year? How many implants have you done in your career? And that will kind of give you a good guideline on the feeling that you get about it. My personal position on it is the doctor that places the implants should be a surgeon, either an oral surgeon or a periodontist. And the reason for this is they obtain very, very serious training in their residency and afterwards in placing the implants. They will generally place between 20 to 100 implants a month, obviously depending on how busy their practice is, and are very adept at dealing with different kinds of issues and that may come up in the placement of the implant. Number 3, how long do implants last? So a well thought out implant placement in the right place with the right occlusion, meaning the right bite, can and should last you over 10 years and sometimes over 20, and in some instances for the rest of your life. So if somebody is telling you, oh, this implant will last you 2 to 5 years, I would be very skeptical of this kind of an answer. Number 4, what kind of sedation options do I have? So the oral surgeon can generally sedate you and do IV sedation for you. Most doctors can do nitrous oxide sedation or do chloral triazolam or chloral hydrate and have you be more relaxed. Valium would work, but an oral surgeon will be able to put you to sleep completely if you're apprehensive of the work. Obviously, if you're not, you could just get regular anesthetic injections and you'll be fine. And the last question, but very, very important question, is who will restore my implant? And this is where I feel is the difference between practices that are multi-specialty practices and group practices versus a single doctor operation. So multi-specialty practice will essentially have an oral surgeon or a periodontist come into their office, place the implant, and work hand in hand with a restorative dentist to be able to restore the implant properly. A small dental practice will be kind of a jack of all trades, a one-stop shop, if you will, with one guy doing everything. So he'll place the implant, he'll restore the implant, he'll essentially do everything for you. As a rule, these doctors generally will not be as good at doing everything as a surgeon who places the implant and a restorative dentist who restores the implant. So a team approach generally is the best approach that gets the most predictable long-term results to a practice. So it would be highly recommended by me to you if the offices you choose would be a multi-specialty group practices where an oral surgeon or a periodontist places the implant while a restorative dentist restores the implant. But this has to happen in one location so that everything can kind of be controlled and they can speak to each other and everything is organized. The results generally will come out a lot better this way and last you a lot longer. So anyways, this is my little information about implants. If you have any questions, don't hesitate to call us. My name is Dr. Zak of Zak Dental.